I'm Dr. John Oyston. Thank you for this opportunity. I'm speaking to you as an independent physician. I've never received any money from the tobacco, vaping, or pharmaceutical industries. For 40 years, I worked in the operating room as an anesthesiologist. I cared for smokers while they were having surgery, such as the removal of a lung or the amputation of a leg, which had become necessary because of their cigarette smoking. If they never started smoking, or if they'd been able to quit in middle age, these surgeries would not have been necessary. I spent the last 14 years working on various tobacco control measures because I've seen the damage that cigarettes do to the human body and to human lives. I believe that tobacco is the real pandemic. Even in this plague year, tobacco is on track to kill probably 5 times as many people as COVID-19. E-cigarettes are many times safer than combustible cigarettes. To ban e-cigarettes is unacceptable. It makes no sense, especially if we allow people to continue to smoke regular cigarettes. Banning e-cigarettes is an infringement of people's rights to choose a safer alternative and to make their own healthcare decisions. E-cigarettes could save about 6 million lives in the United States, and yet some people are trying to ban them and prevent people from vaping. Let's begin with the tobacco industry. The global tobacco industry makes $62 billion in profit at the cost of 7 million deaths every year. They accept the death of half of their customers as the price that others pay so they can continue to make money. They see vaping as an addition to smoking rather than a replacement for it. They prefer the pre-filled pods with high nicotine concentration that are sold in vapes that are sold in convenience stores and supermarkets, because these offer them the greatest profit and the greatest opportunity to addict young people to nicotine. They are opposed to independent vape stores because they help people to stop smoking by providing them with advice and low nicotine concentration e-juices. Juul has performed particularly badly. In Canada, they marketed a so-called starter pack with a ridiculously high 59 milligrams per mil of nicotine. They advertised this product heavily on social media, circumventing advertising laws and age restrictions, and as a result, they pretty much created the so-called epidemic of teen vaping. The World Health Organization is strongly opposed to e-cigarettes, perhaps because they've accepted $1 billion in donation from Michael Bloomberg, who's also heavily against vaping. As a result, they've lied about e-cigarettes, and they've praised countries like India that have banned them. The CDC is so opposed to e-cigarettes that when young Americans started to die from THC carts that were contaminated with vitamin E, they blamed this on regular vaping. They refused to tell people the truth and warn people appropriately, and they scared people back into cigarette smoking. The media will use any anti-vaping story as clickbait. Vaping has been unfairly blamed for causing popcorn lung, for causing collapsed lungs, for causing heart attacks, and even for spreading COVID. Even the New York Times described a vaping canister as like a gun with a bullet. It's just a method of death. Physicians in Canada seem to be strongly opposed to vaping. The president of the Ontario Medical Association began a statement with the phrase, "We all know that vaping is dangerous." The Canadian Medical Association Journal reported what it claimed was a case of popcorn lung, even though the patient had used THC and probably just had another case of EVALI. In the UK, prescriptions for traditional smoking cessation medications fell 70% when smokers switched and decided to use vaping as a way to quit smoking. Johnson & Johnson keeps Canadian physicians on side by supplying them with free nicotine replacement therapy for their clinics. Pfizer helps fund the Ottawa model for smoking cessation, and their conference, Stanton Glantz, made a keynote speech denouncing e-cigarettes. Many US medical charities, such as the American Medical Association, get hundreds of millions of dollars from the Johnson & Johnson Foundation. One recipient, the American Lung Association, claimed that vaping is smoking, and switching from smoking to vaping is not quitting smoking. The Campaign for Tobacco-Free Kids received $117 million and transitioned from being against tobacco to being against vaping. Anti-vaping advocates are even using the COVID-19 pandemic as an opportunity. Vape shops are being closed because they're not considered an essential service, while alcohol and cigarette stores are remaining open, and in some cases even cannabis continues to be sold. The New York City Mayor, Bill de Blasio, has blamed vaping for people getting severe cases of COVID with no evidence. However, there are some signs of hope. When people speak out, things do change. When a flawed Glance publication was heavily criticized, it was retracted. The CDC eventually conceded that EVALI was due to vitamin E, and the FDA has declared that there is no evidence that vaping makes COVID-19 worse. The system may be broken and corrupted, but if we work hard enough, the truth comes out in the end. So how do we fight back? Our patients need more solid and transparent research making valid comparisons between the risks of smoking and the risks of vaping. The results must be clearly and forcefully presented to the medical establishment, to media, and to the governments. To get physicians on board, we need an e-cigarette which is manufactured to medical standards, and we need e-juices which meet pharmaceutical standards, so that they can be available on prescription and covered by health insurance. In the USA, the Master Settlement Agreement has tied some US states to tobacco money. It needs to be rewritten or rescinded. The WHO should be funded by governments and not depend on billionaire donors. Accurate and timely advice about health issues is literally a matter of life and death and must be valued above profit, fame, or career advancement. Journalists must get unbiased medical advice and seek truth rather than sensational headlines. We have to help people to recognize truth and smell bullshit. We need constructive dialogue rather than bitter debate, or worse still, blocking people whom we disagree with. There must be repercussions for spreading false or misleading information. Vapers and smokers planning to quit by vaping must have access to current, trustworthy advice. Unfortunately, Wikipedia has several articles which are biased against vaping and need to be edited to a more balanced position. Medical and vape shop models must work together to promote quitting by vaping. Some smokers prefer to get scientific advice from a medical professional, while others prefer the enthusiasm and personal experience they get from vape shops. Vape shops should employ smoking cessation counsellors, and smoking cessation clinics, pharmacies and hospitals should include vape stores. Finally, we must continue to support and harness the knowledge, experience, and enthusiasm of vapers and vape shop owners, and find a way to amplify the voice of vapers who are healthier having quit smoking by vaping. The grassroots support from the vaping community is our superpower. I believe that Honlik deserves a place in the pantheon of medical giants alongside Lister, Fleming, and Jenner. When he invented the e-cigarette, he gave us a disruptive technology that can prevent people from losing their lungs, their limbs, and even their lives to tobacco smoking. We must make the most of this opportunity. We must not fail. Thank you for your attention.